This is KMTV 3 News Now, live at 6.
New tonight, a new variant of COVID-19 has been found in Nebraska. The Department of Health and Human Services and Nebraska Public Health Lab have confirmed that the New York variant known as B.1.526 was found in Douglas County. An investigation is underway and ongoing, and DHHS reminds everyone as researchers learn more about this and other variants, it remains as important as ever to continue wearing masks and social distancing.
Due to the variant spread and its effect on kids, companies like Pfizer are trying to get kids younger than 16 vaccinated. And this weekend, Pfizer requested emergency use authorization for their vaccine to be used on those 12 to 15 years old.
The medical community in Omaha is confident the EUA will be approved and children in the age group could start receiving vaccines by the end of the month. 3 News Now reporter Rudolph Sanaida has more on what parents need to know before the expected approval takes place.
Pfizer received emergency use authorization to start vaccinating anyone over 16 back in December of 2020. Now the company has filed for an extension of that EUA to include 12 to 15-year-olds. Their most recent data showing 100% effectiveness in that age group.
They had a really nice study, over 3,500 children in that group, and it was 100% effective.
The FDA review process is expected to take a few weeks, but if approved, children 12 to 15 could start receiving vaccines immediately and start being protected from the virus.
I've known some people whose kids have gotten sick, and it's, I don't want that for my kids. I don't want it for myself, but I especially don't want it for them.
Leah Hall has 2 boys, a 9-year-old and a 12-year-old. If the EUA is approved, she says her 12-year-old Wes would be more than willing to get the vaccine if it meant getting back some normal.
And we get the flu shot every year. We're very comfortable with that, and he's always comfortable with it. So to him, it's just another vaccine that we have to avoid viruses.
The news comes as new variants enter Nebraska almost daily.
So I think the variants is causing more infections in younger children.
The highest rise in cases in Douglas County now belongs to those under 19. It's a statistic Leah has a hard time wrapping her head around.
I even feel bad for our 9-year-old because he has to wait even longer.
Both Moderna and Pfizer are currently working on vaccine trials for those 12 and younger, with the expected results of those trials due to be released later this year. Reporting in Omaha, Rudolph Sanaida, 3 News Now.
Children would need to get vaccinated with an adult present and with their consent. Now, doses for children would be smaller, but everything else about the vaccination process would be largely the same. The governor says if it's approved, he would support the emergency use authorization, but also says it's ultimately up to each parent to decide if they want to vaccinate their child.